This story reflects one person's experience. Not every person will receive the same results. Bear in mind that all surgeries carry risks. This treatment is prescribed by your physician and is not for everyone. Please talk with your doctor and see if it's right for you. Your physician should discuss all potential benefits and risks with you. Important safety information about the X-Stop spacer appears at the end of this video. For additional information about this product and treatment options, please visit www.xstopspacer.com.
I'm very active. My wife and I travel a lot. I work full-time. I love being on the water. We always seem to be doing and going and busy.
Irwin Kroskin relishes the fast-paced life he leads with his wife Ruthie and has no plans of slowing down.
Irwin likes to be doing. We like to do together.
We're rarely home.
At 65, Irwin runs a successful architecture firm and loves to spend his free time either traveling or relaxing out on the water.
When I'm on my boat, I'm not thinking about architecture or anything else for that matter. It's a complete break with everything I do in my regular day-to-day life.
But just over 10 years ago, that active lifestyle nearly came to an end as Irwin began to struggle with chronic back pain.
The worst part about the pain that I had was the way it affected my legs. It's really almost like electrical shocks.
I was concerned about Irwin's back pain a lot. I knew that he was in pain. He was not a complainer. And he tried to hold it in, but I was concerned as to how bad it truly was.
Irwin's daily routines became a painful challenge.
As an architect, a lot of what we do is done standing up. Leaning over would also frequently cause my back to spasm.
He would come home from work and he didn't want to do anything. He just wanted to have dinner and sit down and relax.
Just getting in and out of a car or simply walking was hard. Even spending time on a boat could be agonizing.
Going on a boat would be really very difficult. If I went fishing, I'd suffer for 3 or 4 days afterwards.
I didn't want him to live with this pain for the rest of his life.
It's very debilitating.
Irwin turned to over-the-counter medications and epidural steroid injections, but with little success.
No relief at all. Everything would be temporary. It was very frustrating to live with this pain. Really made you feel aged.
And Irwin was adamant that he did not want to undergo a laminectomy to relieve his pain.
The more I learned about it, the less I felt inclined to do that because it's really very major surgery.
Right here is the area of stenosis that you have between the L4-5.
In 2000, Irwin turned to Dr. Grant Skidmore, a neurosurgeon, for help. The diagnosis? Lumbar Spinal Stenosis.
Spinal stenosis is narrowing of the spinal canal where the nerves travel and they don't have the freedom and they're much more readily irritated. And the spinal stenosis typically results in pain that radiates from the back into the buttocks and legs. By sitting in between the vertebrae, it doesn't allow them to come together when you stand up.
Dr. Skidmore enrolled Irwin in an early clinical trial for a new innovative device called the X-Stop spacer.
X-Stop is called X-Stop because it stops extension of the spine. And it's extension of the spine that pinches the nerves. When somebody stands up and walks around, there's more pressure applied to the nerves at the stenotic level.
The X-Stop is implanted between the spinous processes and is designed to keep this space open, so when a patient stands up, their nerves are no longer pinched. And a key benefit for Irwin, the X-Stop is a less invasive surgical procedure.
I particularly was impressed with the fact that the surgery was non-invasive. I liked the idea that we were going to be done as an outpatient.
But initially, Irwin was randomly chosen to be in the clinical trial's control group and not eligible to have the X-Stop spacer implanted. But 2 years into the trial, the FDA approved the device.
When I was offered an opportunity to receive the device, I did not hesitate. I saw no reason not to try it.
Just a few days after the procedure was done, Irwin was amazed at the results.
There was minimal discomfort, very little pain of any kind. The recovery period was remarkably short.
While Irwin received satisfactory results, it's important to note that all spine surgeries carry risks. The X-stop spacer may not be right for those with certain allergies, spinal anatomy, or severe osteoporosis. Approximately half of patients studied achieved treatment success. It's been 6 years since Irwin had the X-stop implanted, and he can't believe the impact it's had on his life.
We've traveled extensively since then. We've done a lot of fairly strenuous trips as far as climbing and walking and hiking fairly long distances.
And Irwin has no plans of retiring anytime soon from his firm. Now, time spent just walking on the beach or out on his boat is relaxing, not painful.
I think the X-stop very definitely helped me resume and retain the active life that I have. I think I'm pretty active for my age.
To see him get his life back was wonderful. It changed everything about him. His frame of mind was better, his humor was better, his moods were better, his back was better.
The X-stop has definitely helped me maintain as a youthful lifestyle.
For more information, visit xstopspacer.com or call 866-581-2717.